Therefore, we have a special guest today, Ms. Kristalina Georgieva, the Managing Director of the International Monetary Fund, Mr. David Malpass, the President of the World Bank Group, Dr. Ngozi Okonjo-Iweala, the Director General of the World Trade Organization, and last but not least, Dr. Tedros Adhanom Ghebreyesus, Director General for the World Health Organization. Welcome. Simultaneous interpretation is provided in the 6 official languages: Arabic, Chinese, French, English, Spanish, and Russian, as well as Portuguese and Hindi. Now, the other participants we will have in the room here are, apart from Dr. Tedros, Dr. Mike Ryan, who will join us shortly, the Executive Director of the Health Emergencies Program, Dr. Maria van Kerkhove, the Technical Lead for COVID-19, Dr. Soumya Swaminathan, Chief Scientist, Dr. Bruce Aylward, Senior Advisor to the Director General, Dr. Kate O'Brien, Director for Immunization, Vaccines and Biologicals, and Dr. Rogerio Gaspar, Director for Regulation and Pre-Qualification. With this, let me hand over to Dr. Tedros for the opening remarks. The floor is yours.
Thank you, Christian. Good morning, good afternoon, and good evening. Yesterday, the World Health Assembly wrapped up a highly productive week of discussions and decisions. It was conducted entirely virtually. While I both miss and look forward to meeting with colleagues in person, I was heartened that together we adopted more than 30 resolutions and decisions on a broad range of health challenges. There was a clear consensus that the world needs a stronger WHO now more than ever. And the 3 recent reviews of the international response to the pandemic reflected the need for a paradigm shift in both the quantity and quality of funding for WHO. Member States also agreed to hold a WHO special session of the World Health Assembly in November to consider developing a treaty or convention on pandemic preparedness and response. This will be a very important opportunity for a new, truly representative, inclusive global compact to keep our health systems, societies, and economies safer. But there is still a lot of work to do to end this pandemic. While we are encouraged that cases and deaths are continuing to decline in many areas globally, there is no room for complacency. The consistent use of public health measures in combination with equitable access to medical supplies, oxygen, tests, treatments, and vaccines remains critical. Tomorrow, COVAX, co-led by Gavi, CEPI, and WHO, alongside key implementation partner UNICEF, aims to raise critical new funds at its AMC summit to further diversify its portfolio and buy additional vaccines for low and lower middle income countries. Fully financing COVAX and ACT-A is key to ending the increasingly two-track pandemic, and I thank the government of Japan for hosting the AMC summit. And today, I'm happy to announce that the Sinovac CoronaVac vaccine has been given WHO emergency use listing after being found to be safe, effective, and quality assured following 2 doses of the inactivated vaccine. Furthermore, the easy storage requirements of CoronaVac make it very suitable for low-resource settings. It's now the 8th vaccine to receive EUL by WHO. It's now crucial to get these life-saving tools to the people that need them quickly. Overnight, I joined leaders from the International Monetary Fund, the World Trade Organization, and the World Bank Group in publishing an op-ed in many newspapers around the world that calls for a new commitment with a $50 billion rapid investment to fund the equitable distribution of vaccines and other crucial health tools. We particularly welcome that in the proposal, The majority of the new funding would be made available quickly through grants, including to fill the Act Accelerates funding gap. This would help us dramatically scale up the production of diagnostics, treatments, oxygen, medical equipment, and vaccines for equitable distribution. Furthermore, this new roadmap reflects the need to enhance countries' readiness and capacity systems to utilize these tools rapidly, safely, and effectively. It should be a real game changer, and as G7 finance leaders meet in the UK this week, followed by a heads of state summit next week, there are multiple opportunities for leaders to step up. As well as securing funds to roll out health tools equitably, now is the moment for leaders to share vaccine doses with COVAX, ensure health workers and other at-risk people are protected, and extinguish variants. Last week, I called for all countries, companies, and partners to work together to vaccinate at least 10% of the population of every country by September and at least 30% by the end of the year. But as we said in our joint op-ed, along with other agreements and surge investment, it's possible that we could reach 40% by the end of the year. Through public health measures and vaccines, we have the means to end this pandemic quickly and save countless lives and livelihoods. But we need the will to make it happen. They say, where there is a will, there is a way. We know the way. The question is, do we have the will? To say more about how this can be achieved, I'm glad today to be joined by Kristalina Georgieva, the Managing Director of the International Monetary Fund. Kristalina, thank you so much for joining us today, and you have the floor.
Thank you very much, Dr. Tedros, for hosting this press conference, and also to you, the staff of WHO, and all the health workers for your selfless service to humanity. Very pleased to join you, as well as David and Gozi, to discuss a matter of great urgency, the need to step up multifaceted and coordinated action to fight the pandemic in the parts of the world falling behind, mostly because of uneven distribution of vaccines between richer and poorer countries. You may ask, why is the IMF concerned with vaccinations? We are deeply concerned because an increasingly two-track pandemic is causing a two-track economic recovery with negative consequences for all countries. And our data shows that in the near term, vaccinating the world is the most effective way to boost global output. In other words, vaccine policy is economic policy. Building on the work of WHO, WTO, the World Bank, and many others, our staff has put forward a proposal, a $50 billion plan to end the pandemic. It has three broad elements, and as you suggested, I would walk everybody on this call through those. First, vaccinating at least 40% of the population in all countries by end 2021, and at least 60% by the first half of 2022. This requires additional upfront grants to COVAX, donating surplus doses, and free cross-border flows of raw materials and finished vaccines. Second, ensuring against downside risks such as new variants. This means investing in additional vaccine production capacity by 1 billion doses, diversifying production, and scaling up surveillance and contingency plans to handle virus mutations or supply shocks. Third, managing the interim period where vaccine supply is limited with widespread testing and tracing, therapeutics, and public health measures. In other words, the things we learn work. And at the same time, ramping up preparations for vaccine deployment in the countries falling behind. Of the $50 billion, we envisage grant financing of at least $35 billion. G20 governments have recognized the importance of providing about $22 billion in additional funding for 2021 to the ACT Accelerator, so we need an additional $13 billion in grants. The remainder of the financing plan, around $15 billion, could come from national governments, supported by concessional financing from multilateral development banks, such as the World Bank on the call today. The $50 billion price tag is dwarfed by the estimated $9 trillion to be gained by the increase in economic activity by 2025, making it the best public investment ever. Success depends on speed, upfront financing, upfront vaccine donation, upfront at-risk precautionary investments, and coordination, all parties working in tandem, public, private, international financial institutions, foundations. And our 4 institutions fully subscribed to it. We at the IMF will not shy away from our own responsibility. We will continue to work with the international community towards faster vaccination and faster recovery so we can ensure maximum efficiency and maximum impact from our collective efforts. We are considering how to complement grants and highly concessional financing from others for COVID vaccinations where this is needed. And we are preparing a new special drawing rights allocation, unprecedented in its size, to boost reserves and liquidity of all our member countries. Bottom line, ending the pandemic is a solvable problem, but it requires coordinated global action now. Thank you, Tedros.
Thank you, Kristalina. I couldn't agree more that this new injection of funds is critical to increasing the supply of life-saving medical tools and end the pandemic. Next, it gives me great pleasure to welcome Dr. Ngozi Okonjo-Iweala, the Director General of the World Trade Organization. Ngozi, you have the floor.
Well, thank you, Dr. Tedros, very much for having us today. And I just want to make a point. I want to also thank Kristalina and the IMF staff for their paper. But I want to say that we often talk of collaboration of international institutions and coherence. The very fact that the 4 of us are here today and our institutions represented is very important because we know it's about saving lives. And this is the time we have to work together. And we are talking about saving lives of people in developing countries, saying that they'll never lag behind. That is why we've come together. And thank you all. I want to thank my colleagues and their staff for bringing us here. Now, there's a joke about 2 economists out for a walk. One sees a $100 bill on the ground and exclaims, "Look, there's a $100 bill on the sidewalk." The second economist doesn't even look down. She says, "It can't be a $100 bill. If it was, someone would have picked it up by now." In the IMF staff paper, as that Kristalina talked about, we've been shown that there are trillion-dollar bills on the sidewalk. To pick them up, we just need to invest $50 billion up front. And we need more cooperation on trade as well. After some initial disruptions, I just want to tell you the role that trade has played. Many people are not aware about that after the initial disruptions in supply chains, trade played a critical role in moving medical supplies and goods around. For instance, in 2020, Total global merchandise trade shrank by 7% in value terms, but the value of trade in medical supplies rose by 16%. Trade in COVID-relevant products such as masks, ventilators, sterilizer, and ultrasonic scanners increased by 31%. Trade in test kits and diagnostic reagents grew by over 40%. For personal protective equipment, PPEs, trade grew by 50%. Even with agriculture, global agricultural trade remained stable throughout 2020, bolstering food security, which was another area of concern for leaders. And of course, COVID-19 vaccines manufactured in multi-country value chains. We know that these value chains are very sophisticated and complex. We've all heard of the example of the Pfizer-BioNTech vaccine using 280 components from 86 sites in 19 countries. But it was trade that helped to move these supplies around. But we've also had constraints on trade. Export restrictions are a challenge that we continue to face and monitor. While it is positive that the number of measures of export restrictions has come down from 109 at the start of the pandemic to 51, there are signs that trade restrictions are still gumming up COVID-19 vaccine supply chains and weighing on production. Trade policy can help with vaccine scale-up in 3 areas. First, by freeing up supply chains for raw materials and finished vaccines. Second, by working with manufacturers to make the most of existing production facilities and building new manufacturing capacity, especially in regions that lack it. Working with manufacturers to keep supply chains open is essential for us to get more vaccines. Third, we know that there's a TRIPS waiver debate going on at the WTO, and while I cannot take sides, we need to get to a conclusion on this debate. We need to promote also the transfer of technology and know-how to get lasting increases in production capacity. WTO members can and should deliver on all 3 fronts this year. And to echo Kristalina, we increasingly see a world divided by access to vaccines and by economic prospects. The two are, of course, related. That's why she said vaccine policy is economic policy. The divergence is visible in the trade data, too. In Europe and North America, import volumes are set to surpass pre-pandemic levels this year. By 2022, European imports are set to be almost 4% higher, and exports 3.5% higher than in 2019. Over the same 3-year period, North American imports are set to rise by 9.7% and exports by almost 4%. Asian imports will grow by a large 9% and exports by an even larger 12.5%. But in contrast, Latin American imports will increase by a modest 1.7% and exports by 1.2%. And in Africa, imports are only on track to reach pre-pandemic levels by 2022. Exports are projected to have risen 2.3% by then. So I say also that vaccine policy is trade policy and vice versa. We won't get the vaccine production increase we need without action on trade. And without ending vaccine scarcity, we cannot get the lasting trade and economic recovery we need. We want global cooperation to save lives and pick up those trillion-dollar bills. Thank you.
Thank you. Thank you so much, Ngozi, in fighting this pandemic since the beginning in a variety of roles. And I appreciate your point that as well as financing, the WTO is doing all it can to ensure the smooth flow of vaccines and raw materials across borders to increase access, while also accelerating negotiations around intellectual property. Finally, we're joined by David Malpass, President of the World Bank Group. David, thank you so much for joining, and the floor is yours.
Thank you very, very much. I join my colleagues in expressing the urgency to quickly make approved vaccines available to everyone. Each of us has an important role in this global vaccination effort. My immediate priority is for countries that have sufficient supply to quickly release doses to countries that have vaccination deployment programs. The World Bank has $12 billion in vaccine financing available now and more if needed to help countries buy and distribute COVID-19 vaccines and to encourage vaccinations. By the end of June, we will have approved vaccination operations in over 50 countries. These countries can immediately use vaccines from COVAX, from manufacturers, and from donor countries themselves as soon as they are made available. It's vital that we speed up the supply chain. We need to shorten the time from the manufacturing of the vaccine to shots in arms. At present, too many doses are waiting to be allocated. They may be stuck in paperwork, sitting in inventory somewhere, or aren't the type of vaccine the country is able to use. In order to maximize the number of vaccinations, doses need to be matched to country programs as soon as they are manufactured. It's important to share information about the allocations so countries can plan ahead. The World Bank is providing transparent access to very detailed information about our projects through an online portal available at worldbank.org/vaccines. We urge other development partners to publish detailed information about their vaccine financing and deployment programs and their delivery schedules. Our website also links to the 140 vaccine readiness assessments referred to in our op-ed today. These will help us fill capacity gaps and rapidly add more financing operations. The financing can be available to countries immediately. For the poorest countries, it is on grant or highly concessional terms. We're also working to expand supply, and we'll be making announcements of investments by IFC, the World Bank Group's private sector development arm. Each day counts in providing vaccine supplies to developing countries with deployment programs in place. I look forward to working closely with my colleagues on these vital tasks. And with that, thank you very much.
Laid out a comprehensive new health, trade, and economic roadmap to increase health equity and speed up a truly global and quick recovery. I thank you again, and Christian, back to you.
Very well, go ahead.
Okay, thank you.